The following segment is sponsored by mobi-c-cervical-disc and Dr. Michael-Peelle.
It can be a real pain in the neck to have a problem with a herniated disc, irritated spinal cord, or impinged nerves. Damage to one of your cervical discs could be to blame. There's now an innovative procedure that can help maintain motion compared to the old standard, fusion surgery. Fox Carolina traveled to an outpatient surgery center in Lexington to interview board-certified spine surgeon Dr. Michael-Peelle. When patients come in to Dr. Michael-Peelle with degenerated cervical discs, they're often in a great deal of pain.
They typically complain of severe pain in two different areas. One is the neck, and the second is the arm. The neck pain is often associated with spasms and limited range of motion, and then the arm pain can be associated with numbness, tingling, or even weakness in the arm.
Dr. Peelle says a cervical disc could degenerate for several reasons.
One is genetics. Secondly, activity and lifestyle during the course of your life can affect how the discs hold up. And thirdly, traumatic events sometimes cause herniated discs as well.
In the past, many surgery options would involve metal plates and spacers or fusion, which limited a patient's mobility. But today, Dr. Peelle says patients receiving surgery with the newer mobi-c technology may maintain motion in their necks.
The advantage of having the mobi-c cervical disc replacement is that it accomplishes the same goals as a cervical fusion with regards to treating the neck and arm pain, yet it has advantages. One is that it maintains the motion at the surgical level so that patients can continue to move their neck normally.
And he says the procedure is ideal for a surgery setting on an outpatient basis.
The patient may come in the morning, have their surgery, and go home the same day to recover. There's no inpatient stay required at a hospital typically for this operation. Candidates for the cervical disc include patients that have 1 or 2 level degenerative discs in their neck. They are typically symptomatic for a period of time and have failed non-surgical measures such as medications, injections, and physical therapy. These patients undergo surgery for continued pain in the neck and the arm.
It's important to note every patient will experience a different post-operative activity level depending on their own factors. But for this patient, cervical disc replacement procedure was life-changing.
My spine surgeon placed 2 mobi-Cs in my neck. It's an amazing feeling. I could just move around anywhere I want. I knew I could go and play with my kids, and that's the biggest thing, is just getting back out there.
With any surgery, there can be risks. Dr. Peelle explains the common risks from surgery with mobi-c cervical disc.
Problems that can occur after mobi-c cervical disc include post-surgical problems such as trouble swallowing for a short period of time, some continued neck and or arm pain.
Mobi-c is not appropriate for patients with an active infection or who are allergic to the implant materials. For information on mobi-c cervical disc, visit cervicaldisc.com. For spine care and minimally invasive surgery options, visit Dr. Michael-Peelle at spinesurgeondoctor.com.